You guys are young, you have the whole world. And just because you have an MD degree or a DM degree, or because you happen to be radiologist, doesn't mean you need to restrict yourself to only doing radiology. It's a much bigger life out there. Learn to be entrepreneurial. There's so much opportunity. You have lots of talents, lots of skills. Reinvent yourself every few years, nothing wrong. And yes, it takes time. But this is what the exponential curve is all about. If you start giving cuts, let's take two doctors. One guy who starts giving cuts. In the beginning, he learned a lot more. But what will happen to his income over time? He learned more, but he'll keep on giving more and more of it away. So the amount he keeps will keep on reducing. Whereas another doctor who doesn't give cuts will take a longer time. But once he reaches that point, his growth will continue to be exponential because he's invested in those digital patient education resources. So we'll continue getting a referral of patients directly, word of mouth, online. He won't have to depend on a GP anymore. And traditionally, this has always been true. In the past, people would go give talks at Rotary clubs, have medical camps. Why can't we do this online? And it's important that we create a network of doctors who don't give cuts, don't demand them. I think the only place for cuts in the medical practice is in the operation theater. There is absolutely no place otherwise. And I think we need to believe that. I think this is what you guys should think of yourself as. And there is something called the joy of practicing medicine, and sometimes we lose sight of it. It's a simple one-line formula. Put your patients first. Everything else will follow. Trust me about this. There's so much positive feedback. Patients are so grateful when you help them, even if they don't do well necessarily. Thank you, doctor. You tried your best. We really appreciate that. Trust me, a good doctor can have the best emotional income in the world. Nothing matches that. And that's something which we need to be grateful for. And again, focus on the quality of the work, not about the money and, a friend has more money and has more patients. Okay, that's just a formula for unhappiness. A lot of what I've described is actually on this website. A lot of these books are there. And I think information therapy is the one way of bridging the gap between doctors and patients. This is a timeless quote from Hippocrates that, if you love humanity, I think automatically patients will respect doctors, and we will respect ourselves if we learn to do this. Thank you.